This patient was referred to me for endodontic treatment of teeth number 13 and 14. She had both teeth prepped for crowns and now she's in a lot of pain. You can see why. Look at the proximity of the decay to the pulp here, and look at the proximity of decay to the pulp here. So irreversible pulpitis. So today went ahead and did tooth number 13. She'll be back next week for tooth number 14. Number 13 was the worst. I do one root canal at a time, and this root canal took me half an hour to do, number 13, and she told me that her jaw hurt. So I told her, I said, we did this in half an hour. And this tooth had 2 canals. This tooth will have 4 canals, so you better be prepared, because this one will probably take me at least an hour, maybe less, a little less, maybe 40 minutes, 45 minutes. But you know, plan for unfortunately having to keep your mouth open for about an hour. I prescribe her, of course, pain medication and also ibuprofen for her jaw pain, and also toothache. Of course, her tooth will be sore after the root canal because we work on it. We traumatize the tooth while doing the root canal. So hopefully her jaw will recover for tooth number 14. And here's the post-op. So take a look here. 2 separate canals that join apically, and look at a lateral here and another one right here. This is another angulation. Again, you can see they start as 2 separate canals and then they join apically, and you got a lateral here and another one here. People often ask me how I get these laterals cleaned, disinfected, and then obturated, and my answer is almost always is you have to have a protocol, a 3-dimensional protocol for instrumentation, cleaning, irrigation, activation, shaping, and then obturation. So instrumentation, shaping, irrigation, obturation, they should all work together. So instrumentation, of course, is if you use NiTi files, you want to make sure that you have a nice glide path. Don't put a NiTi file in the canal unless you have a nice, predictable, reproducible glide path. 6% sodium hypochlorite, that is the irrigation of choice. You want to use that copiously. Then, of course, after each file, you recapitulate. After each file, you, of course, let's start over. After each file, you irrigate, recapitulate, then irrigate again, then go to the next file. And then, of course, activation, either sonically or ultrasonically. Then you dry the canals and you obturate 3-dimensionally like this.